Hello, my name is Ravi Vij. I'm from My Cancer Haven. And today I have with me Dr. Suzanne Lentzsch, who's professor of medicine and director of the Multiple Myeloma and Amyloid program. She's also associate editor for our prestigious Journal of Clinical Oncology. She's at Columbia University Irving Medical Center in New York. And we're going to talk about something that she has contributed immensely to the development of in the last few years, and that is novel monoclonal antibodies for the management of amyloidosis. Welcome, Suzanne.
Thank you, Ravi. Thank you so much for having me here, and congratulations on that really important video podcast.
Thank you very much. So the thing is that we have done programs before for people to inform them about amyloidosis and its workup. So for those who want more basic education, we'll direct them to those videos. But we're going to dive into something that is a little more advanced, and that is how do we, treat something that like amyloidosis with drugs that can get rid of deposited amyloid. So before we get into that, can you give us a little overview about amyloid fibrils? What do we know about its formation, and which lays the groundwork for some of the treatments that you've been developing to solve this problem?
Yeah, so light chain amyloidosis is a subtype of amyloidosis in general. We know that there are many different proteins, actually over 30 proteins, that are able to form amyloid. Alzheimer's, for instance, is a type of amyloidosis, also TTR amyloidosis, but also what we treat the light chain amyloidosis. But there's an underlying principle, and that means that you have a protein that starts to misfold. The shape is not straight and not how it's supposed to be. The shape is abnormal, and that's why you have little aggregates like a clump in your pudding, So those clumps stick together, and after a so-called lag phase, we have a nucleation phase. That means where you have a growth of those abnormal form proteins. And once you have a seed, for instance, in your heart with those abnormal proteins, more light chains build onto that existing seed, and we have a phase of elongation. That means you have a seed in your heart, new light chains circulating in your blood, and they stick to the already existing seeds in the elongation phase. So it's growing and growing.
So obviously, this is an area of great unmet medical need, amyloidosis, and most of the stuff that we have has been borrowed from